like to say diabetes is a disease on a spectrum. A person can have normal blood sugar for many years, even with risk factors for diabetes. Then they will progress to slightly higher blood sugars, and that is a stage that we call pre-diabetes. Eventually, the sugars may reach high enough a threshold that we call it diabetes. This process really takes years, maybe even decades. And so healthcare services have the opportunity to intervene before that moment of diabetes. There are many years before that moment that the person is diagnosed with diabetes. Primary healthcare has an opportunity and a mandate to engage with their communities and offer screening at the level of primary health. Screening can be done using the HbA1c, and the Ministry of Health has recently pushed to make this test available through point-of-care machines throughout the regions, and especially where it may be difficult for a sample to be sent to a full lab. Otherwise, fasting blood sugar and the postprandial blood sugar or the 2-hour OGTT are tests that can be offered to the patient. The importance of screening is that we can really delay the onset of diabetes or prevent the onset of diabetes. And we know that when a person gets diagnosed with diabetes, there may be complications that are already established, even though the person doesn't have symptoms. So the earlier we begin to provide care in the progression of this metabolic state, the better the outcomes. Screening and the schedules for screening is based on a treatment plan and a care plan. Most patients will be asymptomatic. A person with early kidney disease, early eye disease, or even early heart disease will have no symptoms. And so the impetus is on the healthcare team to offer screenings for patients. Even at time of diagnosis, we know that in type 2 diabetes, at time of diagnosis, the physician should be offering screening, particularly eye screening and kidney screening. Eye screening is one of those projects that is not as challenging because the technology is enabling many levels of eye care personnel to take pictures of the retina and then send it for processing. And so eye screening, once it's available, should be offered to the patients. Once again, I would reiterate that most patients do not have symptoms in the early stages of kidney disease or eye disease. Eye screens should be done annually. Once they are normal, they can continue to be offered annually. The same for kidney screening. There are specific tests that can be offered for kidney screening, and a person may have a blood test for kidney that's normal, such as a creatinine, but their microalbumin, which is a urine test, will already have changes. So physicians have to be aware of what are the standards for screening, what are the tests that can be offered, and be diligent to offer screening once they are accessible.